Just talk a little bit about what that whole principle, oxidative priority principle is.
Yeah, it sounds like this big complicated thing, but when it comes down to is the order of what your body processes different fuels. In the first fuel, if you eat a whole bunch of different things, including alcohol, alcohol is the first fuel that it has to metabolize or basically get rid of your through your body because it's completely toxic. There's no storage capacity site. So say, if you had a baked potato with butter and a steak and a glass of red wine, it has to metabolize the wine first before it moves on to all the other food you ate. So I say, well, let's just cut it out because it's a depressant. I was just on the phone with someone who's severely depressed and she had alcohol the night before. And I was like, we know alcohol is a depressant. It's not making you feel any better. So alcohol is oxidative priority number one. Number two is exogenous ketones, which maybe you've heard of, maybe you haven't, but it's these fake ketones, basically these ketones that you can drink that will get you into ketosis faster. Are they healthy? I don't think so, but they could serve a purpose in some case of maybe Alzheimer's, dementia, something like that. But a lot of people drink those because they want to lose body fat. And they've heard, oh, if I get into ketosis, I'm going to lose body fat. Well, if you're consuming ketones, there's no reason that you have to use body fat to make ketones because you just used a fake product to do that. Does that make sense?
Mm-hmm.
Okay, so that's number two.
Mm-hmm.
Number three is carbohydrates. Carbohydrates, you have, a pretty good storage capacity site of about 2,000 calories, whatever. But that's what's going to happen third. The fourth one is protein. And the thing is with carbohydrates, they're not needed. People think that they need them for certain things, but there's no dietary need for carbohydrates.
None.
But protein, there is a dietary need for protein. First of all, it's the most nutrient-dense food you're going to ever find. That's where the nutrients are. It's not in the MCT oil. It's not in the butter. I mean, whether you think high fat or high protein is more important, you cannot ignore the fact that if I put a steak in front of you or if I put a plate of butter in front of you, the nutrients are in the steak. Okay? But the protein is going to cause beautiful hair, beautiful skin. All of the building blocks of your body needs protein. When women in particular do a keto diet, they're like, oh, Maria, I'm losing my hair, my thyroid's suffering, this and that. They're usually doing bulletproof coffee and fat bombs.
Yeah.
And in that case, they're probably not losing very much weight because their body is using the dietary fuel for ketones, not their body fat. So protein is number 4, but then dietary fat is number 5. And I'm not saying no dietary fat. I'm just saying prioritizing protein because you need it for muscle, you need it for so many things of your body, and the nutrients are there. And then fat you use as a lever. So if you want to lose body fat, we're going to turn that dial down. And guess what? 99% of people have some, they want to lose body fat. That's why they come to keto. Turn the dietary fat down. The steak has enough fat in it. You don't need to add a stick of butter to it. But that's what they're reading online. And that's why I get so sad. Like, oh, I tried the keto diet. I talked to all these people all over the place. I tried the keto diet and it didn't work for me. Well, this is why Jillian Michaels says the keto diet's going to kill you because she's reading, oh, they're just drinking butter in their coffee. And, that's not what we are promoting. Some are. That's not what I'm promoting. And so, prioritizing protein. If you're having a hard time hitting your protein goal, I have a free calculator that kind of calculates how much protein you need. If you're having a hard time hitting that, you probably need to, maybe instead of a ribeye all the time, go to a leaner steak because that's going to be a better protein to fat ratio.
Where's this calculator? How do we get
If you go to ketomaria.com, there's a link to the free calculator. It's totally free. We spent a lot of money on it, but it was really helpful for people to find out, oh my gosh, I'm not getting near the amount of protein I need. And when they flip the fat and the protein, they're like, oh my gosh, it's working.
Right. That's right.
And they
Yeah.
feel better too. And their hair grows back, so but if you are doing the traditional keto diet was for epilepsy and seizures.
Mm-hmm.
And that's why people think it's a super high fat diet. Well, you know what? The traditional American diet is high fat already.
That's right. Oh, yeah.
We don't need to add any more to it.
Mm-hmm.
We just need to make sure it's the good fat and then prioritize protein, lower the carbs.
That's right. Yeah, I think a lot of us are not even saying low carb, high fat anymore. We're just trying to restrict the carbs. Most of the time, the body will take care of the rest on its own. Very few of my patients measure their macros, their protein, fat, or carbs. Nobody's really doing that. I just focus on the carbs. And obviously, when they're struggling, and with an emphasis on get adequate protein.